webinars. We can also share the webinars and also all of our presentations that we've done now on Zoom, so that if for folks and affiliates that have not, that could not make certain meetings, they'll be recorded and there'll be easy access to that. Also on the portal, you'll have training webinars for continuing education units, so forth and so on. So it's an exciting piece. In addition to that, we just rolled out Fiscal Note. It's just the beginning. We rolled it out at the beginning of October. There are some of you that have already engaged with the Fiscal Note. There's some of you, and this is on the state level, on the state level legislation. And I have heard through Fernanda that there's some engagement, there's some questions as well about Fiscal Note, but we just rolled it out. I will be providing Fernanda with some additional help so she can get this information out to you. So any questions for me on what I've just reported, because we've been reporting a whole lot to the affiliates, or anything that you want me to comment on before we get into the discussions?
The only thing I'll add, Armando, is that December 6th is the next Professional Learning Series webinar. Dr. Angela Sinner will be presenting. That's part of our ongoing series. And the next one's December 6th, and you should have got an email and can register right away if you like.
Okay. Thanks, James. I really appreciate it. Thank you so much. And for those of you that do not know James Garcia, he's our communications consultant. He helps with not only with the communications, but also with advocacy and many other things, a newsletter, so forth and so on. So he's a great addition to the UCP team. So thank you, James, for everything that you've done for us in this past year, especially during COVID. Yeah, I really appreciate all your help. So with that said, it's always an honor for me to present my friend and a friend of UCP's, Barbara Merle, President and CEO of ANCOR. We've worked together on really important advocacy pieces. And in addition to that, they are our partners for Case for Inclusion. Barbara, you've partnered with us for the 2019, the 2020, the 2021, and now we're working on the 2022 Case for Inclusion. That has certainly brought awareness to ANCOR, to UCP around the nation. Sean Luchtefeld on your team has been tremendous. And I appreciate also my team and the affiliates that collaborate to have this particular report go out there. It's been useful for self-advocates, for other disability organizations, and especially to really bring out some information to our public officials. And we're always looking to advocate for the disabilities community. And I think this is one of many ways how we do it in collaboration. So Barbara, thank you so much again for your leadership. So before we get into this roundtable discussion, and James will facilitate that roundtable discussion, Barbara's going to share some survey results. And these are survey results that speak to the effect of COVID-19 and the effect to our nation's direct care workers. So with that, I like to introduce Barbara Merle, President and CEO of ANCOR. Thank you for joining us.
Thank you, Armando. And hey, hello, everyone. It's lovely to see you. Of course, I wish I'd been out in San Diego. That sounded lovely and warm. We're hoping, we are actually planning to get together in person. The first in-person meeting this January, our Government Relations Committee will meet and retreat. And if any of you want to join us, if you're not already part of the Government Relations Committee, just let us know. It's really one of our most popular events that we do on an annual basis. It's been a couple of years since we've gathered. And so much has happened. So I really, I just really do want to thank you for such a lovely introduction, Armando, and to all of you for trusting ANCOR. Our partnership has been, such a privilege on our behalf. So with some indulgence, I'd like to talk about a little bit more than the survey, and I think folks will see the logic of it. So I'm going to go ahead and share my screen. Uh, Here we go. I'm going to take us, I guess, right to the last slide. So there you go, slideshow from the beginning. Okay, all right, thank you. So greetings from Washington. For those of you who've never been to DC in the fall, it's kind of a lovely little secret. You know, everyone knows how great Washington is during the cherry blossom season, but it's pretty lovely in November. I'm not here just to talk about the weather. I recognize several of you on this call. Since 2001, ANCOR has focused on the urgency of the direct support professional workforce crisis. That's when we launched the National Advocacy Campaign. If memory serves, I wasn't with ANCOR at that time, but I think Joe Anello was one of the original co-founders of the National Advocacy Campaign. And that was all about professionalizing the workforce, working to increase wages, training, opportunity, and really recognizing excellence. So we actually sunsetted that campaign when we got into the Great Recession, when our attention turned to lobbying Congress specifically for federal FMAP stimulus relief to get through those really, really hard lean years. But prior to that, 4 different Congresses in a row from 2004 to 2012, we caused to have introduced in the House of Representatives legislation that actually is pretty interesting because it's not dissimilar from what's being discussed in Congress today. It was legislation that gave states an option that if they wanted to address their workforce crisis and they came up with a plan, they would get an enhanced FMAP. At one point, we had over 200 members of Congress sign on to it. We were getting ready to introduce a Senate companion when the Great Recession hit and the conversation changed. But obviously, the workforce crisis has only continued to worsen. As I stated on the last slide, although we sunsetted the campaign, we analyze every single proposed regulation that comes out of any of the federal regulatory agencies, any proposed legislation, any trends, specifically through the lens of, is this policy or this rule going to help providers recruit and retain a qualified workforce or not? And that's how we look at policy. That's how we look at our educational offerings at our annual conference. That's how we look at webinar offerings. That's how we look at all of the tools that we offer members. And if you haven't looked at that in a while, just Google DSP Toolkit on our website, and you'll find an array of tools there, including the realistic job preview. But here we are. I want to take us back. This is the cover of the 2019 National Core Indicators Staff Stability Report. It actually, they call it the 2019 report because it reflects 2019 data, but it wasn't published until I think late 2020. It was in the field, the data was gathered then. And so what did it say? It said what everybody is living. The weighted average of DSP turnover across I think 29 states participate in the staff stability these days. The weighted average was almost 43%. But the much more important number that we always looked at was the numbers up above. As you can see, almost 20, one state had a turnover rate as low as 24%, but several other states were in the 60 to 65% rate. So, I mean, just incredibly unacceptable. The reality that we've lived with, if any other industry, celebrated a 20 or 30% turnover rate, they wouldn't be in business. In our field for years, a state turnover rate, as low as 20% is actually considered good. So right before the pandemic hit, literally in February of 2020, we decided to get, to just really dive deeper into the data. We've been hearing our members tell us for years that things were getting much worse. We had the big numbers, 43%, some states as high as 65% turnover rate. But what did that really mean? What was the actual impact to services? We've been hearing from folks anecdotally that was having, tremendously bad impact, but we didn't have data. So we put the survey out in the field. We had an extraordinary response. We had 805 respondents. And this is what they said. 66% told us that they were turning away new referrals. And I just want to pause there. I have had the honor of representing providers of services for people with intellectual and developmental disabilities since my son was born back in 1992. I took a couple sabbaticals from our field, but I've been here pretty consistently. And for years and years and years, I've listened to providers talk to us about how bad things are. A new rule came out, I knew this, the rates weren't increased. But nevertheless, you guys do what nonprofits do. You just continued to take new people. You just continued to make more room at the table. Even though you had to stretch and stretch and stretch, you continued to do it. Well, finally, this was the first time I'd seen it, that we had seen data that people weren't doing that anymore. They weren't making room at the table for one more. Almost 66% turning away new referrals. 43% of you told us that you had discontinued programs or services, and this is pre-COVID. 43% of you told us that you had stopped doing things. 65% of you told us that you were delaying the launch of new programs or services. And then there's this statistic. 40% of you told us that you were seeing a higher frequency of reportable incidents. And then 7 out of 10 respondents told us that they were experiencing difficulties in achieving quality standards. So that's pretty tough stuff. And particularly tough stuff given, a number of years ago, Senator Murphy from Connecticut, persuaded CMS and the Office of Inspector General to investigate abuse and neglect in group homes. There have been headlines in states around the country about bad things happening, but never once had we seen and obtained data like this. But then came the pandemic. Right. So, we got those results back in February. We were analyzing them, we're pulling them together. We were planning to release them in March. Actually, I think we were planning to release them in April. But then the pandemic hit. We all know what that did. It changed, once again, it changed the conversation in every way. We completely shifted into advocating for all of you, your staff, to be recognized as the essential frontline workers that you were and continue to be during this pandemic. We were advocating for money. We were advocating for flexibilities from CMS. And advocate, we did together. Thank you so much. The UCP affiliates have really, really responded to our action alerts. Just huge thank you. But nevertheless, kind of just to go back, a little PTSD, we advocated and advocated and advocated, and it took months before the money to really start to open up for our providers, causing us to launch the Forgotten Faces campaign. But then finally things started to open up. As you recall, the Paycheck Protection Program was first passed. It applied initially only to smaller providers, but notably, this was the first time ever Medicare or Medicaid providers had ever been eligible for SBA loans of this nature. Just a quick look at our accomplishments. In March, the CARES Act was signed into law. That's the one that appropriated all kinds of money that was to go and did go into the Provider Relief Fund. Again, you know, it was that Provider Relief Fund that we just kept advocating and advocating, was about the 5th tranche before they finally opened that up to all of you. But then Joe Biden was elected president. Obviously, the pandemic is still full flower, but his proposed American Rescue package was big. And what actually ended up passing? A 10% increase in FMAP. It's only temporary, only for a year, but that was huge, specific for HCBS. The Paycheck Protection Program was expanded for large employers. A boatload of money was sent to states, you know, for state and local governments. We're aware that in a number of states, some of that money was loosened up for IDD providers. The president also proposed raising the minimum wage. That one piece did not make it through the final package. So what have states done with these American Rescue Plan dollars? To begin with, a number of states still haven't started sending money to providers, but that is going to start to loosen up very soon, and states will be able to bill for the 4 quarters. I was talking to folks from New York yesterday and really assuring them that even though you guys in New York have not seen anything under ARPA yet, it will come. But really importantly, look at these statistics. 47 states in the plans that they've submitted to CMS on how to use that 10% temporary FMAP bump, 47 states are including something, some form of action that's going to directly impact DSP wages. Maine is calling for 60% of provider rate increases to directly filter to DSPs. New Hampshire is including provider payments with expectations that a certain portion will be used for DSP bonuses and stipends. You know, a lot of states wanted to do bonuses because this was just supposed to be a one-year thing, and they were nervous about, you know, an ongoing obligation. Tennessee is doing a one-time referral incentive of $1,000 for DSPs coming to work for a provider. Some states are doing childcare stipends. A number of states are doing student loan repayments. District of Columbia is actually proposing a rate increase to cover the cost of DSP transportation to and from service locations. So, preview for what's to come. Game changer. Forgive me, I always like these slides. The president's massive proposal that is before Congress right now, the American Jobs Plan. And in that plan, you know, he has, you know, made it very, very clear that he considers care to be infrastructure. Now, this bill has taken a long time to work its way through. It was paired with the physical infrastructure bill that was just signed into law. What is it, just earlier this week? No, I guess it was late last week. But now this bill has its path forward. The House has advanced it. We are now waiting for the Congressional Budget Office to come out with the score for the bill. That was the deal that was worked out by the moderate Democrats in the House of Representatives that were a little gun shy about signing on to another huge bill. But assuming the CBO score is consistent with what the president said that it was going to be, it will pass the House and then go on to the Senate. So now I want to get back to the DSP impact. survey. So we've been working and lobbying for this huge bill. I just wanted to kind of quickly tell you where it is. I mean, literally this week is so important. We're really hoping to get it passed, this next week. It's possible it might go into January, but this thing has taken a while and it's been painful. So it prompted us to do another survey. And this is the survey that we did that Armando shared the statistics for. We had it out in the field in August. It is an update from the previous one. And what was the difference between pre-pandemic and continuing during the pandemic? I wish I could say post, but obviously we're not post. Folks, previously 66% of you said you weren't taking anyone new. Now it's almost 80%. 34% of you, were closing programs pre-pandemic. We know the impact of the pandemic, particularly on day programs. Almost 60% of the respondents said that they've completely closed programs. Far more, almost 85% have delayed the launch of new programs. The number of you telling us that you're having trouble achieving required quality standards has gone up. It was crazy high to begin with, 69%. Now it's 81%. And then the last statistic stayed fairly flat. Thank goodness, not surprising, although 40% for reportable incidents is already just incredibly high. We think the reason why that one did not increase much is because you guys are just really, really good at what you do. You've been working incredibly hard to keep people safe during this pandemic. We also think another reason why this statistic didn't increase more is because a lot fewer people are being served. We're concerned about that. We're just enormously concerned about that. So, kind of before I go on, I want to share, when we got all this data back, I looked at this, I looked in the mirror, I looked at our staff. We talked to, our volunteer leaders, and I made the decision to take this data, the outcomes of this data, directly to the Anchor Board of Directors to ensure that the Anchor Board fully supported us sharing it. Because this is pretty bad data, and this isn't the kind of thing that associations generally, share. When you've got problems this significant, it's not the kind of thing that you're not only releasing, but you're going to the press to get story, to get coverage of, that you're sending directly to Congress. But the Anchor Board, came back and just completely affirmed what our Government Relations Advisory Group had advised. The answer was, we have no choice. This is so dire right now that we've got to release this data. If this data can make a difference in getting more money, both at the state level and the federal level, it's really incumbent upon us to tell the story of what is really happening in the field. So let me just really quickly share with you just a couple more slides. What is in the Build Back Better Act, the one that is sitting right before Congress? You've heard us talk about it. It was originally, as the president proposed, going to be $400 billion for HCBS. That number is now down to 150 billion, but oh my heavens, you guys, 150 billion. That still, if that remains, it will still be incredibly, truly historic. It'll be the largest infusion of cash in the Medicaid program since the Medicaid program was created. That it will amount to a 6% FMAP increase. All right, so do the math. We currently have this 10%. That's temporary. That will be for the 4 quarters. When this passes, I'm not going to say if, I'm going to say when this passes. Obviously, it will jump it down to 6, but it will be for 10 years. And 10 years translates in the world of Washington to permanent. It's considered permanent funding. States will also this is optional for states. And some states may not go for it because there are strings attached. States are going to have to sort of submit their plans. But some states will be eligible if they opt to for an additional 2% if they want to create programs to support self-directed care. Here is the fascinating, fabulous thing. And then if you had told me a year ago that I was going to be presenting before all of the UCP affiliates and telling you or reminding you rather, because I know a lot of you are following this closely, that this bill actually has language that is going to require states that accept the money that they will have to review their reimbursement rates initially 2 years after their plan is approved, and then after that, every 3 years. That's the holy grail. How many states virtually never review their reimbursement rates, their payment rates? Far too many. I mean, so this will be just a huge piece. And then, there's more. It's a permanent extension of money follows the person. There's going to be $270 million for a grant program to help states that are choosing to phase out of 14C. $270 million to help transition to integrated community employment, competitive employment rather. And then here's the final piece. And boy, there's nothing final about this. There is a provision in this that there will be $1 billion available for grants to qualified entities to invest in strategies to recruit, retain, and advance the direct care workforce. And folks, I've looked at the definition of eligible entities, and you're going to be eligible entities. This is just a tremendous opportunity. It's a tremendous opportunity for entrepreneurial providers to find great partners and submit proposals because this is going to allow you to do just a ton of, this is going to allow you to finally put some money behind a career ladder. This is going to allow you to, pay people more for being credentialed. There are just all kinds of opportunities. So I wanted to share that. It's so important. We're at this historic moment, and that is exactly why we released the DSP Impact Survey. So thank you, Armando. I'll stand by for questions and the panel discussion.
Thank you, Barbara. We really appreciate that. Any questions before we get into the next section of this conversation for Barbara?
All right, Barbara, just a quick question. You're following this, particularly this aspect of it much more closely than I am, but while there's been some serious conversations about what could be cut after it leaves the House, after this next phase of the bill leaves the House and goes over to the Senate, it doesn't seem as if HCBS funding is really particularly threatened, at least at the level that it's at right now. Does that seem to you the case?
James, it's extraordinary, but that is our read. I actually took a slide out and trying to be a little bit more concise. The public polling about the popular pieces that are in this big, massive bill. HCBS services for seniors and people with disabilities is the second most popular of the provisions in it. So, we're not the controversial piece.
Yeah, that's comforting.
Yeah, I mean, just to be, full disclosure, right? When it gets to the Senate, it's got to get, Joe Manchin, Senator Joe Manchin from West Virginia, and Kristen Sinema from Arizona. Both of them are going to have to sign on, and inflation. Everybody's talking about inflation. Everybody's weirded out about the price of gas and the supply chain issues. I mean, there's just a lot of funky stuff going on with the economy right now. So the overall price tag could come down. So is it possible that we might see that come down a little bit? Yes, but I really think that if this baby passes, there's definitely going to be a lot of money for our provisions.
But let's all keep our fingers crossed, of course. Okay. Shall we, Armando, go to sort of
Yeah.
next place to
Yeah.
just moderate the session? Okay, great. So I've already been introduced. I'm going to moderate the next section. We have with us, and Barbara, I do want you to be involved in this part of the conversation as well. We have Roger Slingerman, who's the Executive Director of UCP of Central California, and we have Melissa Boswell, who is the Director of Human Resources at UCP of Arkansas. What I'd like to do is just kind of dive right into a conversation. And we have a decent audience, so don't hesitate to jump in and offer your feedback, because I think this part of the conversation is really about what are you seeing on the ground. We've heard the numbers, which are not encouraging. We've heard some talk about perhaps some money that's going to come down the pipeline later on. That is encouraging, but what's happening on the front lines right now? So if you don't mind, let's go first to Melissa. Melissa, after having listened to Barbara's presentation, how does that correlate with what you're seeing on the ground in terms of the people that work for you?
Oh, right on. I think the numbers for the turnover rate and everything are pretty accurate for us as well. And the different things that we're experiencing, the shortage of employees, the things that we're dealing with the pandemic. I know the numbers weren't pandemic, but it kind of goes in with that. We really are experiencing the same side of things, the same challenges. We salaries, we can't get our salaries where they need to be because of the lack of funds and everything that's going on. But
yeah. And Roger, does it correlate again with what you're seeing there on the front lines?
Yeah, it does. Ours actually, we've been fortunate, from that standpoint. We've lost some staff, and turnover hasn't been that bad here in our particular program, but across the programs here in Fresno County and in California, I know it's been a real issue from that standpoint. But there's just the salary is a big issue. As part of it is a lot of ours start at minimum wage, which is now 15 in California come January. And we've had a 5-year increase every year since I've been here, from 50 cents to $1 a year. And everything's compressed. So some people that have been here 15, 20 years are making $16.50s, maybe $17, just slightly above minimum wage. So it's been real difficult to try to make those aspects happen. And I know it's state to state, and I know there's some issues there, but there's just, if you look back, 20 years ago, there was minimum wage was $5.75, and people with DSP at that time were making $7, $8 an hour to start, which is well above minimum wage percentage wise. We're barely above minimum wage at this point. So there's some dollar issues and some math problems with the
but that has to be a real struggle. I mean, I'm seeing, for instance, in Arizona, which is not the cheapest place to live these days in Phoenix area, but I'm seeing fast food places offering $14 an hour to start. So you've got competition, that kind of competition from unlikely competitors in some way. How are you guys dealing with sort of really, if you look at the numbers that Barbara's presented, kind of a crisis situation that's a crisis on top of a crisis that's been around for a long time?
Right. Well, we're just trying to recruit people. I mean, whether we do it through Indeed or through the website or through marketing or through friends of friends, those type of things. And we're spreading it thin. Because of COVID, we don't have all of our students back in the program. We have about half. So at that point, the ratio of staff and student here, we can kind of make it. But as we start to bring more people back into the facilities, in addition, that's going to become more and more of a challenge. And, there's programs then in California, the vaccination issue, or anywhere over 100 employees or more. And, there some programs are going to lose possibly 60 to 100, 30 to 40% of their the staff aren't vaccinated, and they may lose them. So that's a real issue from that standpoint of, how they're handling it from a different standpoint.
What is the size of your staff, Roger?
We have about 110. Pre-COVID, we were about 144. So we're about 110 right now.
Okay, so you would qualify into that. Melissa, how are you dealing with the situation in real time?
Rogers sounds just like we are here. Our minimum wage has gone up $2.50, dollars in the last 2 years. We can't keep up. And we had a year ago, probably about 750, 760 employees. About 600 of them were direct care professionals. Now we're down 100 just from last year. Now we have lost some people when our daycare reopened, things like that. some of the students just didn't come back. But we're having the same type of issue and trying to, our minimum wage went from $8.50 to $11, December 31st of 18 to January 1st, 2021. And so people who were making, just as Roger had pointed out, people who were making $2.50 more than minimum wage are now making minimum wage, and we can't do much at this point to correct that. We have to do other things with retention and recruiting. Recruiting is actually harder. We're trying to keep the people we have and do different type of retention things like merit bonuses and things like that.
Yeah, are you finding that your staffs are responding to the whole context of the situation, in particular the impact that COVID has had? Are they responding in a way that, in other words, are they saying, we're in this. This is what we do and what we care about, and that you're getting some help from them in that regard, from your staffs?
Correct. Yes, we are definitely. The 550 direct care professionals that have stuck around and stuck through this have done fabulously. I think we've handled COVID very well. If there was a situation where someone was exposed and had to be quarantined, the staff just jumped right in, and if they needed to work an extra shift, they would, to cover those places. So yeah. I feel like the ones that have stuck around are just fabulous. They're doing a great job.
Yeah, throughout. Oh, go ahead. I'm sorry, Rob.
No, I was gonna say I'd agree with that too, because the creativity of the staff and, the virtualness and, the point of mental stability too with a lot of our staff and their home issues and their changes, and trying to, be creative in the ways to keep people, mentally sound when we go through this, not only me, but the rest of the staff as well. But yeah, it's been creative, that's for sure.
You took the very next question right out of my mouth. Psychological issues, mental health issues are just across the board, something that everyone is having to deal with. And how are you guys dealing with that? Is this something that you're proactive about as an administration?
Well, yeah, we a lot of things here, just trying to, keep them sane in a lot of respects, but with staff, it really helped that students started coming back into the program back in April. I think if it kept going any longer, you start to lose the focus. People say, what am I here for? So that's a big benefit. Trying to do small things around here, whether it's lunches or little bonuses or a few days off, or we're going to close at Christmas for an extra day or two, even though we don't bill, but it'll be beneficial to the health of them, so they can spend time with their families. So it's I think each of the programs tries to do a little different ways they can and still be able to afford to do it, because it's anything you do like that costs you money. But to me, that's short-term dollars. We're looking at the long-term effect of how we do this, and I think some people get caught up in that, and we try not to do that.
Melissa, when you sit around the table, you're planning meetings for the week or the month, how much of a conversation is this, the mental health of your staff?
Very important, of course, because we lost some individuals, and 6 months later they come back. We want to come back because they had such mental strain that they needed to get out of the workforce altogether for a short while. We have an employee assistance program. We have an EAP system, which we've had for as long as I've been here. And so they have an opportunity to call someone if they need assistance. We have tried to do different things, like bring in a snow cone stand for I know that sounds simple, but just to get them through the day for our daycare. And Paula, of course, our CEO and our CFO went around to all the different areas that we have and don't have. And then we also had a place for all the labor workers who wanted to come, the direct care professionals, in which they just kind of had a little festival, had different things that they offered and did drawings and stuff like that. And again, those seem very small, but they help with the morale.
It's a human touch, right? I mean, there's that much that's needed. I certainly like when my bosses are human and treat me as human. Barbara, I mean, what you're hearing right now, if you could just sort of respond to what you're hearing from Roger and Melissa.
Oh, it's just really consistent. Just, I tried to get a hold of a couple board members a couple weeks ago, and I couldn't get a hold of them because they were actually pulling shifts themselves.
Yeah.
that members are telling us that they're, forget this one day at a time thing, everybody's sort of focused on one shift, even in much larger agencies that are supporting many people, the C-suite, the upper level management is just super focused on making sure there are enough bodies covering shifts. I'm kind of loving, hearing that, students are coming back, and not surprisingly that it's just so important, for your staff, right? I heard that loud and clear, what are we here for if we're not seeing people, if we're not, part of it, so much of this work is so tangible, but some of it has just not been tangible. Yeah.
Roger and Melissa, are you, there's been a lot of conversation, for instance, about service industry folks, particularly restaurants and that kind of thing, just jumping ship, deciding I'm going to do something else for a living. And a lot of that conversation sort of centers around people that just don't want to go back into a workspace that puts them at risk. And so some of them are deciding to do something else. I'm going to become a remote salesperson for State Farm or something else. Are you hearing that from your workers as well? Maybe it's some of them not coming back because they're just worried about exposing themselves?
I personally haven't heard that. Most of our workforce, once they get here, they want to be here, and they're here for a reason. So I think, there's kind of an entry, or there's a lot of them start at one point, like, looking for a job. It's an entry level position on a lot of our positions. And, again, that's where we get the competitiveness of, you can go to Costco and you go to In-N-Out Burger out here and make more money, right off the bat. But is money more important to you than actually providing the service? And, it's a created family within the organization that we have. And that doesn't matter what level, whether you're the ED in my position or all the way down. People, care for each other in that respect. So I think that's where it is a little different. And I think that's where the funding has always been like, well, you can pay them a little less because they're going to come for that reason. Well, that's not always the right way. And I think there's enough monies in our state when they appropriate the dollar amount there to give to us. They just don't give us everything they say they're, that we're just trying to spend and go around and do. So I think there's the money. Part of it's a money issue. Part of it's philosophical, in my opinion.
Yeah, absolutely. Melissa, you've lost about 100 employees, you think, since last year?
Okay, since probably last year and a half. I don't know that they're changing careers so much as, maybe they're not working. I think we have a lot of people who aren't working at all, especially when with unemployment was paying $300 a week and everything. I think we just had individuals that just weren't working. Now, whether or not that was because they were afraid of going into the homes, I don't know. I hadn't.
You haven't actually heard that.
No.
Yeah. So and then finally, and I want to go to the audience, but finally, are you getting assistance, whether it's through the American Rescue Plan or some other means from the states themselves? Have they been helping you get through some of this, and in particular dealing with the workforce? Melissa, if you
Go ahead.
Yeah, and I'm not, I'm just told I have money, and where it always comes from, I'm not exactly sure. But how am I going to spend it? But I know, in 2020, we had the DCWP payments that we were getting, that our employees were getting every week based on how many hours that they worked. And as of now, that's all the money that we've received, to my knowledge. And I'm not saying we haven't gotten any grants or anything like that. I'm not privy to all that information. But I know that when I was talking to Paula about some of these things, and when we were talking about how the state's help, she said right now, our state has put us in managed care. And so right now the state really, there's not a lot of things going on for us right now. There's hope, and we have hope down the road, but right now there's not a lot of assistance. I don't think.
Okay, Roger, anything you can add to that?
Yeah, I can, because it's like you sit here and go, well, no, not really, but yes, they haven't. Because the structure of the system has changed somewhat. There's alternative services now, so we do a lot of virtual services. And for almost starting last September, we actually could get we haven't really stopped billing for our services from the time all this took place in March back in March till now. And the bottom line is they have created alternative services that seem to work. so that when people are at home, we can do things, whether it's through Zoom, just like we're doing here, creative, we go out in the community or we go out to their homes and do things and, you know, drop off packages and doing that aspect of it. And we've been able to bill for those services. And I'll tell you what, it should be part of the future services as we move forward. Now, this is state to state and program to program, but the bottom line is at least they've thought outside the box and enabling us to say, hey, we want to make sure this continues to go. And how do we do that? And you've got to be able to do that because we got to be sustainable. We've got to be able to pay people to be here and pay them whether there's a staff here, student here or not. And that's where that money comes in. And ratios are a real big part of the solution, I guess.
Yeah, Barbara, if you could kind of speak to that, particularly, you know, what states are doing, but I'll just preface it by saying I heard something just a day or two ago on National Public Radio about 1,000 bills involving telehealth around the country in various legislatures. So it sounds like people are interested in somehow keeping that part of the conversation, part of the process, I should say.
You know, and absolutely. You know, we've been advocating for a long time for states to pay for the whole variety of technology, between, just accessible technology, remote monitoring. But it really took until this pandemic for CMS to really start seeing, I think, the real value that technology can offer people, particularly people in rural areas. But it's not just rural areas, right? You want to take a cooking class at night, right? You don't have to go out of your house. You can do something like that, and people with disabilities can benefit from that, enormously. So let me share. A couple of weeks ago, I was invited to a listening session that the CMS administrator convened, and she asked us to list our priorities. This is Chiquita Brooks Lazur. She's the head of Medicaid, and I thought real hard, long and hard about how I was going to use this real incredible, important opportunity, to not only address the administrator but her 20 staff. And we decided to just 100% focus on the workforce crisis because it is so huge. With our message, to them, if the workforce crisis isn't solved, they're not going to be able to, advance the community settings rule, et cetera, et cetera. But a number of other national associations devoted a significant portion of their time to advocating for CMS to continue to be flexible and even more flexible, and really send the message to states that this type of not just telehealth, but just all the opportunities that technology offer to support people in a variety of ways be continued. So that's really encouraging. That's one of the silver linings. There weren't a lot of silver linings, but that's one.
Yeah, and it does seem like a real avenue that people, at least right now, are seriously investigating if there are that many proposed bills out there. And unfortunately, as someone just mentioned, the states are all over the place in terms of who gets to do what and when and for how much longer, right? In terms of what's all getting past COVID. I want to just sort of open it up to the audience and let them know too that we're at about 5 till the end of the hour. But if you want to stay on, I could certainly stay on for a few more minutes, and hopefully our speakers can be on for just a few more minutes. But if folks from the audience, kind of an open-ended question, just raise your hand. What unique are you doing on the ground to retain and recruit workers right now, given the environment? Feel free to jump in. Anyone?
I can jump in.
Thanks, Todd.
We aren't doing anything horribly unique. All we're trying to do is create a really good culture, a work culture that is responsive to our workers. We have about 350 caregivers in the field, and we do a payroll service for them. And so we make sure every time card is paid accurately and on time. We don't want one single glitch. We don't want them to be upset by anything, and just really focus on their caregiving and not get caught up in paperwork, so to speak. So we do everything we can to make any paperwork problems, which is all paperwork to them, that we will have somebody available to help them, contact them. They have a specific number they can call to talk to a specific worker at our office. So that's what we've been doing, is just hyper focus on customer service and workplace culture. No drama, no issues. This is a place where you come in and we are respectful of who you are and what you're doing. And as we all know, that doesn't come without great work in the background. So that's what we've been doing as far as pay and everything goes. We're trying our best to keep up to, but the margins are so thin that it's difficult. So listening to the rest, the new bills coming up, or hopefully will pass, sounds very promising. I just had a brief question on the 14C piece. We don't provide employment services, but as you mentioned in your slides about things that are on hold due to everything, we would love to get into integrated employment, competitive employment, all of those avenues. We're not interested in getting into 14C. But would any of that possibly have an incentive for us then to get into that, whereas we don't provide that service now? So it'd be nice if there would be some incentive to be another provider that would be helping to get gainful employment for people. So just curious if that was
Barbara, can
possibly in there.
And sure, I'd love to, Todd. And the answer is I really hope so. Once the bill, by the way, I just got a text from our lobbyist that Speaker Pelosi is thinking that she's going to have the House vote tomorrow on the reconciliation bill. And it's on Twitter that the moderates seem to be happy with the numbers they're seeing. So this is like a cause for celebration. I mean, I'm not going to celebrate too early. But once it gets passed, again, if I'm not going to say that, when it gets passed, then it's going to go to CMS and the Department of Labor, the different departments, for them to promulgate rules and guidance. And, that's going to be the next lobbying front for us. Absolutely. To really get in there and positively influence the guidance. There's probably going to be, because there usually is, a lot of flexibility for what states can apply for and how they want to use the monies. So a question is, the question will be, will this just go, will it only be for states to apply for this? And then you would apply to Wisconsin for money to start a new program supporting people in, a competitive and supportive employment? Or would it be an opportunity for you to apply directly to the federal government? We'll see what those details will be. But really your question is this money only going to become, be available for providers that are currently doing shelter workshops who are going to be transitioning? We'll see. I don't know that for certain.
Okay, we're at the top of the hour. Are there any final questions that folks want to pass along? If not, I'm going to pass it back to Armando to close for the day. And thank you, Barbara, and to the two speakers who have been here today with us. I really, really appreciate it. Armando?
Yeah, James, thank you so much. Just wanted to share with the affiliates that the quarterly town hall meetings for fiscal year 22 will include mental health resources for affiliate staff, social enterprise best practices. And we had a really deep conversation at the West RAC in San Diego about diversity, equity, and inclusion. So these are topics that have come from the affiliates, and we'll be working closely to get you some professionals that will speak to that, or affiliates that may want to provide their input. But my sincere gratitude, Barbara, always, thank you for joining us. Melissa, thank you so much for your input, for your participation. Roger, I hope you're doing well, you're feeling better. Thank you also as well. And James, thanks for the facilitation and all of you that joined us today. So be well, and thank you for participating in our quarterly town hall. Thank you very much.
Thank you, everyone.
Thank you.
Thanks, guys.